a wonderful and fortunate day. Here in front of you is a 10th grade student who has come to deliver information that you will use on the topic of using contraceptive methods to make life easier and safeguard our health. In our society, more and more people are becoming involved in teenage pregnancy. According to PopCom ABS-CBN, 1 out of every 10 women aged 15 to 19 becomes pregnant early. Many families do not plan their pregnancies properly, and the number of HIV or AIDS-infected teens is rising due to unprotected sex. These are disturbing. Who should be responsible for this? But all of us, we need to do our best to let the youth know what they will do to prevent it and launch programs to guide people about it. What, who, and how does poor planning affect not only them but also young victims of violence that has resulted in them having children and young people who have been tempted to have sex? One of the major concerns is that the world's population is growing at the same time that the number of HIV patients is increasing. As the world's population grows, so does the demand for products and services. And if our economy can keep up, poverty will intensify. Parents and young moms struggle to raise their children, and children are affected negatively by poverty, with some parents failing to provide their children's fundamental needs. We have birth control, also known as contraception, to limit or avoid overpopulation, adolescent pregnancy, and the existence of STI and STD. Contraception is a method, medicine, or device used to prevent pregnancy. It's also known as contraception or family planning. You can take contraception if you have sex but don't want to get pregnant. Contraception comes in a variety of forms. Contraceptive implant is a type of contraception that is implanted into the body or Implanon NXT. It's a 4 cm long flexible plastic stick. The hormone progestogen is steadily released into your body by the implant. The hormone generated by the ovaries is comparable to progestogen. It acts by preventing each month's egg release from the ovaries. The fluid around the cervix or the entryway to the uterus won't thicken as well. This aids in preventing sperm from entering the body. A qualified doctor or nurse injects the implant beneath the skin of your inner upper arm. Before the implant is implanted, a local anesthetic is given to ensure that you do not experience any pain. You should be able to feel the implant under the skin after it has been put. The positive aspect of this is that it is the most effective contraception method. It has a 3-year longevity. Many people experience low or very minimal vaginal bleeding. Periods may be less painful than others. Your acne can get better, but it's safe to use when breastfeeding. It can be removed by a professional doctor or nurse at any moment you want. Your fertility immediately returns to normal once the implant is removed. Many ask of you that, what's the implant's effectiveness? The implant has a success rate of over 99% in preventing pregnancy and can last up to 3 years. Intrauterine devices or IUDs. The intrauterine device is a small plastic or metal device that is inserted into the uterus to prevent pregnancy. IUDs are classified into 2 types, the hormonal intrauterine devices and the hormonal copper intrauterine devices. The hormonal IUDs are small plastic T-shaped devices that is inserted into the uterus. Progestogen is present in the hormonal IUDs. This is a synthetic version of the hormone progesterone, which is produced naturally by the ovaries. The hormonal IUDs have a coating membrane that regulates the slow release of progestogen into the uterus. While the non-hormonal copper IUD is a small plastic device with copper wire coiled around the frame. It is inserted into the uterus where it constantly releases a small amount of copper. It works because IUDs alter the movement and survival of sperm in the uterus, preventing sperm from meeting and fertilizing an egg. IUDs can also alter the uterus lining, making it more difficult for a fertilized egg to adhere to the lining and begin a pregnancy. Hormonal IUDs can sometimes prevent the ovaries from releasing an egg. How is an IUD used? A trained doctor or nurse insert the IUD into the uterus. You have the option of having a local anesthetic or sedation while it is inserted. The IUD insertion takes approximately 15 minutes, but you will be in the clinic for at least an hour. The IUD is attached to a fine nylon string that exists through the cervix. The string is not visible, it does not swell up from the vagina. If you feel a high up inside your vagina, you can check for the presence of the string and confirm that the IUD is still in place. It's a good idea to do this once a month. If the string feels shorter or longer than usual, or if you can feel it at all, the IUD may have shifted and you should consult a doctor or nurse. What's great about IUDs? It's a highly effective method of contraception. Once inserted, you will only need to check the string once a month. It has a longevity of 5 to 10 years depending on the type. You can use it while breastfeeding. There are no medication that can stop it from working. It can be removed at any time by a trained doctor or nurse. Once removed, your fertility quickly returns to normal. How effective is the IUD? Both types of IUDs are among the most effective methods of contraception with more than 99% effectiveness in preventing pregnancy. Injection of contraception or depot. What exactly is a contraceptive injection or depot? The contraceptive injection, also known as depot, is a progestogen injection. Progestogen is a hormone similar to that produced by the ovaries. What is the procedure for the injection? Functions in the same way as the implant. The injection prevents the ovaries from releasing an egg every month. It also thickens the fluid surrounding the cervix. This aids in the prevention of sperm entry. How should I administer the injection? Every 12 to 14 weeks, a doctor or nurse injects depot into the arm or bottom muscle. What are the advantages of the injection? It is very effective. It lasts between 12 and 14 weeks. Most users have no or really light vaginal bleeding, and periods may be less painful. You can use it while breastfeeding also, and there are no medication that can stop it from working. How impactful is the injection? So, each injection has a greater than 99% success rate in preventing pregnancy and lasts 12 to 14 weeks. If you receive a late injection, it may only be 96% effective. Contraceptive pills are daily pills that are taken at the same time each day to prevent pregnancy. There are two types of contraceptive pills: the pill or combined pill or oral contraceptive pill, and other contraceptive pills, the only progestogen pill or many pill. The pill is a once-a-day medication. The pill is made up of two hormones, the estrogen and progestogen. These are comparable to the hormones generated by the ovaries. The progestogen-only pill is taken once a day. The hormone progestogen is contained in the progestogen-only tablet. Progestogen is a hormone identical to the generated by the ovaries. Vaginal ring or Nuva ring. How does the vaginal ring function? The vaginal ring prevents the ovaries from releasing an egg every month. It also thickens the fluid surrounding the cervix, the entrance to the uterus or womb. This aids in preventing sperm from entering. How to apply the vaginal ring? We place the vaginal ring into your vagina by squeezing it like inserting a tampon. Every 4 weeks, a new vaginal ring is required. Each ring is left in the vagina for 3 weeks. You then remove it, discard it, and wait 7 days before inserting a fresh ring. Once in the vagina, most users are unable to feel the ring. Typically, you will have your period a few days after removing the ring. You can avoid your period by skipping the 7-day interval and immediately putting a new ring. What are the advantages of using a vaginal ring? If you desire, you can use it to skip your period. Periods normally grow lighter, more regular, and less painful as they progress. Acne can be improved, and the risk of developing ovarian cancer reduces. It can help with the symptoms of PCOS and endometriosis. When the medication is withdrawn, your menstruation soon returns to normal. What is the efficacy of the vaginal ring? When used correctly, the vaginal ring can prevent contraception by more than 99%. It may only be 93% effective if you fail to put a fresh ring in use it correctly or take certain drugs. Condoms. Condoms are contraception devices that function by blocking ejaculate or cum from the penis from entering the vagina or anus. There are two types of condoms available: the external condoms and internal condoms. Both types of condoms help prevent both pregnancy and sexually transmitted illnesses or the STIs. Condom on the outside, the external condom, is a thin pouch made of latex or rubber, but is also available in polyurethane plastic and polyisoprene synthetic rubber. Before it enters the vagina, mouth, and anus, during the sex, you place it on an erect penis or sex toy. The internal condom is a soft nitrile synthetic rubber pouch with two flexible rings at each end. Before having sex, it is put into the vagina or anus. Diaphragm or kaya. What exactly is this? A diaphragm is a shallow cup-shaped silicone diaphragm. Kaya diaphragms are offered in one size. It is combined with Kaya gel, an unique gel. How does the diaphragm function? The diaphragm in gel acts as a barrier, preventing sperm from traveling from the vagina to the cervix and then into the uterus. In the vagina, the sperm die quickly. Many of you ask that what are the advantages of the diaphragm? You can use it up to 24 hours before having sex. It has few or no side effects. You can purchase it without a strip. What is diaphragm's effectiveness? If used appropriately every time you have sex, the diaphragm is 86% efficiency at preventing pregnancy. Because of incorrect use such as not inserting properly before sex or removing too quickly after sex, the diaphragm may only be 82% effective at preventing pregnancy. Withdrawal or pulling out. What is this exactly? Before ejaculation, the penis is withdrawn or pulled out of the vagina while coming. It is not recommended as a method of contraception, especially for young individuals who are the most fertile, but it is more successful than not using contraception at all. How to make use of withdrawal? Before ejaculation, withdraw the penis from the vagina. It is critical that the ejaculate cum does not come into contact with the vaginal entrance. If you have intercourse again, there may be sperm remaining inside the penis or on the hands. Before having intercourse again, sperm can be removed from the penis by passing urine and properly washing the penis, as well as from the hands by fully washing them with soap and water. What is the advantage of withdrawal? There is no fee, always available, neither equipment nor drugs are used. There are no adverse effects. What is the effectiveness of withdrawal? When used appropriately, withdrawal is 96% effective at preventing pregnancy every time you have sex. Given that it can be difficult to withdraw the penis during intercourse and that sperm may be in the pre-ejaculate or pre-cum, which is normally not felt when it leaves the penis, withdrawal may be only 80% effective. Another one is vasectomy. What exactly is a vasectomy? Vasectomy is a simple surgical surgery that closes the two sperm-carrying tubes or the vas deferens. After a vasectomy, you will still have erections and ejaculate, but your sperm will be absent from your semen. This technique of contraception is sometimes known as sterilization or the snip. What is the efficacy of vasectomy? Vasectomy has a success rate of over 99% in avoiding conception. It is thought to last indefinitely or permanent. When does it begin to be effective? It takes about 3 months after a vasectomy for the sperm to be removed from your semen. To avoid pregnancy, you must abstain from sex or use another method of contraception during this time. What are the benefits of a vasectomy? It is quite effective. It is a quick and easy process process, it is indefinite or lasts forever. It has no effect on the amount, appearance, or feel of your ejaculate or sperm or cum. It has no effect on your capacity to enjoy sex or achieve orgasm. It may allow your partner to cease taking other forms of contraception in order to avoid pregnancy. Tubal ligation. What exactly is tubal ligation? Tubal ligation is a minor surgical technique that uses small clips to close the two fallopian tubes. The fallopian tubes are the pathway through which the egg enters the uterus. This technique of contraception is often known as getting your tubes tied. What is the efficacy of tubal ligation? Tubal ligation prevents conception in more than 99% of cases. It is thought to last indefinitely or permanent. How does a tubal ligation procedure work? Sperm must fertilize a developed egg for pregnancy to occur. With menstrual cycle, a mature egg is released from one of the ovaries, a process known as ovulation. The discharged egg travels through the fallopian tube into the uterus. Tubal ligation closes the fallopian tubes, preventing the egg from passing through to the uterus. This prevents pregnancy by preventing the sperm from contacting the egg. Where can you get tubal ligation? A tubal ligation can be performed by a gynecologist in a hospital or as day surgery. What are the advantages of it? Very efficient, can be performed at no cost at a public hospital, though wait times can be lengthy. Long-term or last forever, it has no effect on how frequently you have your menstrual period. Those who do not wish to use hormonal contraception have a choice. It has no effect on your capacity to enjoy sex or achieve orgasm. It may allow your spouse to cease taking other forms of contraception in order to avoid pregnancy. It may lower your risk of ovarian cancer. What about contraception after pregnancy? Contraception is not required until 21 days after birth or 5 days after a miscarriage or abortion. However, if you are having sex and wish to avoid pregnancy, you may benefit from starting earlier. It is up to the individual to decide when to begin utilizing contraception after pregnancy and which method to employ. What is emergency contraception? Emergency contraception is a contraceptive method used after sex has occurred. It is used to prevent pregnancy if you had sex with no contraceptive protection. For example, when there is a broken condom, missed or late pills, or no contraception used. The two main types of emergency contraception is the pill, sometimes called the morning after pill, or it is available in two types, the ulipristal acetate, sold as Alawan, in the levonorgestrel, multiple brands. Non-hormonal copper intrauterine device or IUD. The non-hormonal copper IUD is a small plastic device with copper wire coiled around the frame. It is inserted into the uterus where it is constantly releases a small amount of copper. How effective is emergency contraception? Emergency contraception pills are about 85% effective at preventing pregnancy. The ulipristal acetate emergency contraceptive tablet L1 is more successful than the levonorgestrel emergency contraceptive pill at preventing pregnancy. The copper intrauterine device is more than 99% effective at preventing pregnancy, and if inserted, can survive for up to 5 to 10 years depending on the type. What is the mechanism of emergency contraception? The emergency contraceptive pill stops or postpones the release of an egg by the ovaries. The copper IUD alters sperm movement and survival in the uterus, preventing sperm from meeting and fertilizing an egg. IUDs can also alter the uterine lining, making it more difficult for a fertilized egg to adhere to the lining and begin a pregnancy. The last one is the fertility awareness methods or the natural family planning. What are fertility awareness practices? Fertility awareness approach prevent intercourse during the fertile period of the menstrual cycle, the time pregnancy is most likely to happen. How effective are fertility awareness methods? Fertility awareness strategies strategies can be more than 99% efficient at preventing conception, depending on the method used to detect the fertile time and when to avoid sex. Some approaches may only be 76% successful at preventing pregnancy. What are the benefits of this? A developed egg must be fertilized by sperm for pregnancy to occur. Ovulation is the release of an egg from one of the ovaries throughout each menstrual cycle. Fertile days are the days closest to ovulation, when pregnancy is most likely. After ovulation, an egg lives for roughly 12 to 24 hours, while sperm lives for about 6 days. This indicates that a menstruating woman is normally fertile for around 7 days of her menstrual cycle. The 5 days before ovulation, the day of ovulation, and the day or two after. One strategy of preventing pregnancy is to avoid sex on certain days. How to use fertility awareness methods. Using fertility awareness approach requires a thorough understanding of the menstrual cycle as well as careful daily monitoring of body changes. It is suggested that you consult with a healthcare practitioner who is trained in fertility awareness methods before utilizing them. The following combination of physical changes can be documented every day to determine the fertile time and when to avoid sex. What are the advantages of fertility awareness method? It is compatible with a wide range of religious and cultural views. Understanding the fertile periods might also help you get pregnant. It does not use any artificial hormones or chemicals. Contraception is your option. This involves the access to safe, effective, inexpensive, and accepted contraception techniques as well as the freedom to choose when and how to reproduce. You have the right to choose the sort of contraception that is best for you. I urge that you consult with your doctor or nurse for evidence-based information on all contraceptive methods so that you may make an informed decision based on your personal needs, preferences, and medical suitability. But as much as possible, don't try to have sex with someone because you don't know if he or she is infected by STI, STDs, HIV, and AIDS. And if you can take the responsibility of being a parent, don't risk your future. The Bible says, go and multiply. But it cannot be removed from the reality that others are still using it as an excuse to cover up the mistake they made by having so many children. Isn't it preferable that we reproduce according to how many children we can support? Again, I'm Kristen C. Saura from 10 STA Rowing Gen. I'd like to leave a praise by being educated on contraceptive methods and being responsible in our action, we can prevent overpopulation.